Hi, today I'm here with Dr. Thomas Ylioja, Clinical Director for Health Initiatives at National Jewish Health. And you are located in Denver, correct?
Right. We are in Denver, Colorado.
And you work on the project, My Life, My Quit?
That's right. So I'm the clinical director for health initiatives, and one of our programs is the My Life, My Quit program.
Okay, so that's why we're here today, because we are going to talk about vaping. And it's taken a backseat to everything else in the news for a while. But there are parents still really struggling with their teens struggling, teenagers who are using and can't quit. So I'd love you to describe the program, My Life, My Quit.
So My Life, My Quit is a dedicated program for teens under the age of 18. Part of what it is a cessation program that really treats nicotine dependence regardless of what source it is. So whether it's from smoking or from vaping, which is what we hear a lot more now. To really help young people, we were addressing a need that we could see that young people just didn't want to use our quit line programs, but they did want a resource that they knew it was just for them. So we created the My Life, My Quit program to reach those young people.
So you had a quit line program already in existence, but you were seeing that teenagers weren't actually using it.
That's right. National Jewish operates 18 state quit lines across the country. And so we were really in a position to monitor whether young people were using the quit line program. We were hearing from, in the news media, a lot of stories, people saying that there was just no resources available. And our quit lines have always worked with people who are under 18. So we went out and we talked to young people and said, what about the quit line? What we were hearing from them is the quit line is for adults, it's for people who smoke, and they didn't see it as the resource for them. So we asked them, what did you want? They said they wanted to be able to text with somebody. They wanted to talk to somebody who they knew would listen to them. They didn't want to talk to their parent necessarily. A lot of times their parents didn't know that they were vaping, so they were looking for something confidential, and it needed to be free. And so the My Life, My Quit program is all of those things. It's free, it's confidential, it's just for teens. It was designed with input from young people who were looking for help with quitting.
So first of all, how did you say we heard from teens? Well, we all know that's not so easy. So how did you hear from teens?
Yeah, we actually went out and did a lot of focus groups in the Denver area. Colorado has one of the highest rates of teen vaping in the country. And so there was no shortage of young people that we had available to talk to. So we went actually talked to young people in high schools. We held focus groups in classroom settings and asked them, you know, what are you hearing about vaping? What do young people need to know? What do they need in order to be able to help them quit? And we took all of that information and plugged it into the My Life, My Quit program.
So tell me what it looks like. You know, some kid reaches out, and then what happens initially? What happens after that?
Great question. So when if somebody's looking for help, they would, you know, they may see a poster in their school gymnasium or in a hallway. They may be looking for a resource or see a banner ad on YouTube or social media that says go to mylifemyquit.com. Once they get there, there's lots of really helpful information that they can review about vaping, about tobacco products, about nicotine, and then they can enroll there as well. So if they enroll there, they can access our online program. They can also sign up for telephone calls or for text messaging. The nice thing about our program is that there's a toll-free number that they can call to talk to a coach, or they can text a phone number as well, and they can reach one of our coaches, and it's always live coaching on the text messaging. So they can always chat with somebody who's, you know, knows how to work with young people. They've been trained specifically on working with young people, and they're also tobacco treatment specialists. So they go through our same training program that is, you know, really rigorous in terms of helping people quit using nicotine products.
So how many states are signed on for this program?
We currently have 20 states around the country that are part of the program. When somebody's enrolling online, there's one of the first questions is which state do you live in? If it's not in the drop-down list, then we're recommending that they try one of the other programs like the smokefree.gov teen text messaging program or the Truth Initiative's text messaging program, or calling a quit line. I think all state quit lines across the country offer some sort of services to people who are under 18.
Okay, so I've just checked and I'm so disappointed because my state is not on that list. Can you give like 2 tips, 3 tips for parents of what makes your program work, and is there a way to help their kid at home?
Really good question. We on our website have resources for parents. There's a few things on there about how to talk to your teen about vaping, how to help them with quitting. Even if they can't access the My Life, My Quit program, there may be resources in terms of getting them connected with their primary care doctor or pediatrician. Sometimes there are school-based programs or other online programs that they can use. Um, None of them look exactly like our program in terms of having the live coaching available over text messaging, but there are some really good resources out there. But parents definitely need that education about what nicotine is, what these products are. We encourage them to look through our website and learn a little bit about what these products are. Once you're knowledgeable about the products and how they work, it's easier to have a conversation with young people about what you might be seeing and hearing, and ask their opinions on what they're seeing and hearing, because they've probably heard and seen more than you have at this point as well.
So use your kid as the educator.
Kids are great educators when it comes to it, and it's also a chance to find out if they have myths about them. So some of the myths about vaping products among young people is that they're just water vapor, that they don't contain nicotine, and we know that those aren't true, and that vaping is generally, there's very little water in it, and only about 1% of all vaping sales are nicotine free. So the likelihood that they're using nicotine in one of these products is very high.
So, I have a kid at home. I want to do something. Are there ever success stories without joining one of these programs?
Sure. If you have a good relationship with your teenager and they're listening to you, and you can and have a conversation about what quitting looks like, then absolutely. We hear from parents all the time who are reaching out for support and saying, "I'm not quite sure how to help my teen." So we're sometimes are coaching them on what to say or how to work with their young person to address it. Sometimes it's as simple as setting up a quit plan, identifying what their triggers are, what's going to make them want to use nicotine, and then how to get around, how to deal with those triggers, how to manage the cravings. If currently medications are not approved for anybody under age 18, so things like nicotine patches or gum or lozenge. If somebody is really addicted to nicotine, then you may want to talk to your physician, primary care doctor, or pediatrician about whether these might be an option for young people.
Okay, so your program sounds amazing. People should go where to check it out?
They can go to mylifemyquit.com. There's lots of really good information on there. There's good resources for parents, for educators, for healthcare providers, information about how to help young people. And even if you can't sign up for the program because it's not yet offered in the state where you live, there's good information and other referral sources on the pages for parents where to direct you to different resources out there, different places to find more information. There's beginning to be a lot more information about how to help young people, what parents need to know. So really encourage parents to learn as much as they can so they are really knowledgeable when they're having these conversations with their teen.
How many kids are involved in the program right now?
So we launched on July 1st, 2019. So we're about 11 months in. We've had about 1,200 or so young people from across the country enroll in the program. Our early results look like it's, because there's really no true evidence-based programs that have been really rigorously studied with young people. There's beginning to be more studies. So we're trying to add to that by evaluating our own program. The quit rates look pretty good. They're definitely comparable to what we see in our general quit line program. So we're encouraged that we're helping young people at the programs like the My Life, My Quit program are on the right track in terms of helping young people stop.
Okay, can you tell us something hopeful for parents who are dealing with this right now?
There's been a lot of changes in the policy environment with things like getting rid of flavors, increasing the age of purchase, cracking down on internet sales. These are all kinds of things that we know are effective in stopping young people from having access to nicotine. That will help reduce the likelihood that young people are taking up these products in the future. For somebody who's already struggling with nicotine addiction, we know from the evidence that effective treatments are out there. People can quit, people do quit. Even when you look at people who currently smoke, or have ever smoked, more than half of people who have ever used nicotine products have stopped today. So there are more people who have stopped using nicotine than currently do, and that's a sign of hope for the future. The more that we can do to prevent young people from taking them up, and more things that we can put in place to help them stop, the better we'll all be.
Great. Dr. Thomas, thank you so much for being here with us.
Thank you.